Selamat sejahtera, and my name is Keshni Lavina. I'm from Malaysia. I'm doing occupational therapy course. Here I'm going to present a case study. My client name is L. She is working as a maid and she looking after a geriatric patient, and she from Philippines. And here got a background of Miss L. Here got four part of river flow cross sections: part 1, part 2, part 3, and part 4. From part 1, Miss L was enjoy her life with her family members at her motherland in Philippines. Miss L is important in she gives importance to the religion and family member. She spent her most of time in church with her family members because her father and her grandfather is a father at the church. That's all. And Miss L problems is after her marriage she get pregnant, so she have to stop her work because she can't perform her work as well before. And Miss L influence factor is her life is the marriage at 22 years old. After her marriage, she enjoyed her life with her husband as well. She loved to be a Christian, and she participate all the events that carry out in the church. Furthermore, she also have to stop her work after her pregnant. Those influence factor affects her life too. And the riverbank, the social environment is L family member who always care for her, and L's husband who looks after her, and L parents who well wisher for L is in her life. And physical environment that Miss L faces is her house and the church, where she spends most of the time with family and relatives. Furthermore, her workplace where she worked before a pregnancy. Part 2 from the cross section of river flow. Life. Miss L life started to change after her husband left her when L's son grew up at the age of 3, and it's become more hard to overcome all the problems that she faced in her life. L problems start to rise after she became a single parent after her husband left her to get second marriage with another girl. She suffered a lot because she have to look after her parents and son. She have to go to work to find some job to earn money to look after her family. The influence factor that is she face is she find a new job to earn money to look after her family. So she find job with high salary to cover up those problems that she face. The physical environment is the home where she does and her son and her parents stay. And the social environment is her son, herself, and her parents. Part 3 from the river flow cross sections. The river flow L planned to start to work in Malaysia at Mr. J house to look after Mr. J mom in Malaysia. She is a patient who have MSA disease and she unable to participate in activities of daily living and instrumental activities of daily living. So she start to work in Mr. J home in Malaysia. The problem that Miss L face is Miss N have a psychosis. So Miss L face some problem because Auntie M psychosis when started the level will increase. Her behavior will be like a small kid because she start to throw the food around, scold Miss L, and the hallucination problem. Auntie M. So this all make Miss Miss L and Miss M misunderstanding between both of them. The influence factor is Miss L get fed up with Miss M because of her behavior of the psychosis. Furthermore, Miss L tried to advise and explain to Miss L about Miss M, her mother condition, and the real situation of Miss M. The physical environment is where Miss L and Miss M stay, and the social environment is Mr. J, Auntie's M son, and who care for Auntie, and Miss L, who look after Auntie M. The team helper for Auntie who care for Auntie M and spend time with Auntie M always. The second step is the evaluation. Here I could carry out four types of assessment for Miss L. That is role checklist, depression, anxiety and stress scale that is called task 21, and the third one is occupation questionnaire. The fourth one is sensory pattern questionnaire. The first assessment role checklist. The role checklist was designed to include information about a person's occupation roles. Occupation roles consist of a both playful and productive behavior. Playful behavior are characteristic as non-work such as hobbies, sport, or social reactions. Productivity behavior contributes some service or commodity that others need or deserve. It is a reliable and validity assessment tools that provide first one data on individual perception of their participation in role throughout their lifespans, data regarding the degree to which role is valued, and supplemental information regarding an individual capacity to maintain a balanced amount of role. These are the three things that be related to this assessment. These are the sample of the form that I have done the role checklist. Um, you can have a look on this. The result for the role checklist. Leah's most important things in her life is student, worker, looking after someone, looking after home, doing things with family and doing things with her religion. These are the things that important for Miss L. Second assessment depression, anxiety and stress scale DAS 21. The DAS 21 is a 21 item self report questionnaire designed to measure the severity of a range of symptoms common to both depression and anxiety. In completing the task, the individual is required to indicate the presence of the symptoms over the previous week. Each item is scored from 0, did not apply to me at all over the last week, and to 3, applied to me very much or most of the time over the past week. The essential function of the task is to assess the severity of the core symptoms of depression, anxiety, stress. Accordingly, the task allowed not only a way to measure the severity of the patient's symptom, but a mean by which a patient responds to treat can also be measured too. And you can have a look. This is a sample form that I have done with Miss L, the task 21. Result for the depression, anxiety and stress scale task 21 for Miss L is depression score is 4, anxiety score is 5, stress score is 9. So the depression level is normal, the anxiety level is in the mild, and the stress level is in the mild stage also. So she is a normal too. Assessment that I carry out is the occupation questionnaire. In this occupation questionnaire, you will be asked to record your usual daily activity and to answer some question about those activity that mentioned in. This assessment is to understand your life routine. Y'all can have a look. This is the occupation questionnaire form that I have done with Miss L. Here the sample that I have done go through with Miss L too. Continue assessment from the assessment of occupation questionnaire. This form is actually from day to night. Wake up until went to bed again. Bed to bed things will be recorded in this one form. And the result for the occupation questionnaire is she looking after Auntie M for 4 hours, and she took 2 hours for the meal and cleaning home for 7 hours 30 minutes in a day, and rest she used 1 hour 30 minutes in a day and sleep 9 hours in a day. So this is overall 24 hours in a day activity that she have performed. The fourth assessment that I carry out, that is sensory pattern questionnaire. This form is to identify the sensory level and to find out the pattern of the sensory toward a person. The sample form that I have done, this is the sensory profile questionnaire form. This is how it's look. The result for the sensory pattern questionnaire is she is a sensory and bystander. She score high at the sensory and bystander. Is 45 and the 37. So she also an auditory bystander, visual avoider and sensory, touch sensory, movement sensory, and taste and smell seeker. The intervention for the overall case study for Miss L is to make avoid her stress and tiredness. So these are the aims, and the intervention is make a schedule for Miss L to do her work, homework, and look after auntie so she can divide her time and she can manage her time to avoid her tiredness. If she keep on rushing and keep on working, sure she will get tired and stressed. So this is one of the intervention that we can carry, and my aim is there. And the second aim is to get her in a social life such as going for church, spending time with friends and etc. Because before she went to Malaysia, she have spent time with the church a lot and spending time with the friends and relatives in church. So after she came here, she has like just stuck in the home, so it's make her more stressed. So maybe we can give her one off day once a week so she can plan her day herself to enjoy herself so she can relax her mind too. So these are the some intervention that I plan for based on the aims. And thank you for listening.